You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the latest advancements in cosmetic surgery. My first guest is Newport Beach cosmetic surgeon, Dr. Michael Elam. Dr. Elam, welcome to the program.
Thanks, Randy.
How long have you been doing cosmetic surgery?
Almost 30 years. I started actually in 1976. I finally moved to California in 1979, and I've been in offices in Newport Beach since 1980.
Now, you were one of the first guys to bring liposuction to this country, is that right?
Yeah, actually 1981, and I studied under Dr. Elouse and Dr. Fournier in Paris, France, and came back and started doing the operation immediately, and formed the American Society of Liposuction Surgery in those years.
Is that right?
Yes, and I was really the past president in 1984 and 1985.
You still do a lot of liposuction?
I still do a lot of liposuction. It's one of my favorite operations.
Now, we've invited you on the program today to talk about what's doing cosmetic surgery, specifically face. We'll talk a little bit about lipo later. And I will tell you, I interview physicians nationwide, and I try not to endorse any of the doctors on the show. I'm just asking the questions, as I say, but I will tell you, these are the best photos, or they are the best photos I've ever seen, the best before and afters.
Well, I think, the thing about cosmetic surgery is this. Cosmetic surgery has really become of age. With all the TV programs that talk about cosmetic surgery, all the shows that show cosmetic surgery, cosmetic surgery, Randy, is not just for the rich and famous anymore. Cosmetic surgery can help a lot of people, and it helps a lot of people with their self-esteem, their appearance, and helps them through life. And
it's become more mainstream, and it's very popular now, right?
In some instances, it's really a life-changing experience for patients. And I got some good examples to show you, some interesting patients, interesting stories.
Okay, now before we get into the specifics of the keys to a natural-looking facelift and things like that, your background, your training.
Well, I trained at Charity Hospital in New Orleans. I spent 7 years as a resident there, and when I came out, I was in practice with a very famous cosmetic surgeon, learned from really one of the best, and was an apprentice in my early years. And gradually, as the specialty improved, the techniques improved, I embraced a lot of the new technology, liposuction being one of them, facial rejuvenation, endoscopic surgery, and really I've evolved over the years. And I can tell you now that surgery now and cosmetic surgery in general is much better than the early years.
Is it that much better? 20 years?
Oh, it's much
later?
more predictable. The results are better. The patients are happier, and the taboo surrounding cosmetic surgery in the early years no longer exists. I mean, a lot of that has to do with Phyllis Diller and the popularity that
you did Phyllis Diller's.
I did Phyllis
one
Diller.
Or two facelifts for her.
I did 2 facelifts on her, and it really helped bring cosmetic surgery to the forefront. And all the new shows and these extreme makeover programs have really endorsed cosmetic surgery and really brought it out of the shadows.
Now, for people that don't know you, you're one of the most. I mean, you're one of the busiest guys in anywhere in this business, and you were, in fact, I think, on Lifestyles of the Rich and Famous. I mean, you have a big Hollywood following as well.
Well, I do, but I limit what I do because I realize that you have to have balance in life, just like you have to have balance in surgery.
Now, back to what's changed. I mean, what specifically has changed in the last 20 years that makes, for a better result?
Well, I think the most important innovation in surgery in general, I mean, we're talking about heart surgery, belly surgery, lung surgery, any type of surgery, has been the use of the endoscope. The endoscope and the endoscopic techniques involve small incisions, so we can do the same operation through a tiny incision. We can take out your appendix for a little bitty incision. And in facelift surgery, you can do a lot of the facial rejuvenation procedures that required big incisions, large scars, prolonged healing time through small, tiny incisions.
Now, you're one of the guys, by the way, very, very interesting. I mean, that you truly believe, we've talked a lot off camera, that you're changing lives, that their personalities change.
I mean, that's the most rewarding thing about what I do. And, I see it every day. And
people become more outgoing, more confident.
I mean, that's the reason why I do what I do, really. Because I can see a life-changing experience in a lot of patients that come in. I mean, even young people, old people, everybody, I think that gets a successful result has some degree of increased self-esteem. In the workplace today, older people are being replaced by younger people every day. And I think the most common reason why we do facial rejuvenation or facelift operations in patients are they work, they have a job, they have a career. And it's kind of like wearing a nice suit, driving a nice car. It's an appearance improving issue that most people have to face when they get to be 45 or 50. They want to look and feel young.
Let's start with the patient goes into you. Take me through the process. I mean, how do you look at the face? What seems to age first?
Well, there's 2 types of aging. There's the chronological age, which is the number that you put on the age, and there's the physiologic age, and that's the miles on the odometer. And the most useful technique that we have in our office is a computer, an imaging computer. And what we do is we take a photograph of the person, and we basically look at the photograph from different angles, and we show it to the patient. and we talk about what changes they want to make and what things they don't like about themselves. And then we're able to morph that photograph and actually do the changes on the picture.
Is that pretty accurate?
It really is accurate. You know, we don't overdo it. We don't oversell it. We use it as an index of what can be done. There's no guarantee or no warranty associated with it, but in general, I do better than the image machine does.
So what subtle changes make the biggest? Let's start with the eyes. What are you doing for the eyes?
Well, I think the most important thing about the eyes is most patients who come in and want their eyes done really traditionally need a brow lift. Let me show you a couple of photos I brought today, Randy, and I'll show you what I'm talking about. This is a good example of the youngest patient that we see in cosmetic surgery. This is a young girl that was brought in by her mom because she had protruding ears. And usually what happens around 6 or 7 years of age, these little girls or little boys get teased by their peers. This girl was having a lot of trouble in school. She was being teased by her peers. She was doing poorly in her grades. And she brought her in to have her ears pinned. And this is about the age that we do this.
And that's an easy procedure.
It's a relatively easy procedure, and it changes this little girl tremendously. This little girl's now a straight A student. She's very popular. And I mean, would she have been that way anyway? Well, maybe so, but this really helped her.
Let's take a look at a few more.
Let me show you a really good example of what I'm talking about when I talk about endoscopic surgery and I talk about brow lift operations.
Okay.
This young lady comes in, she's about 45 years old, and people tell her she looks tired, she looks sad, she looks angry. And her eyes are kind of baggy, and she just doesn't feel good about herself. This is what we call a Scarless Facelift. By making tiny incisions in this patient's forehead and doing a little surgery around the eyes, we can rejuvenate this person and make them look much younger, much better. And the operation has minimal downtime.
Now, when I look at the before and after, she had bags.
Right. Well, we take the fat out. We take the fat out from around the eyes, from the inside of the eye, without an external incision, and we lift the brow and reposition the cheekbones, and that's the key to it.
So this woman, brow lift,
lower lid blepharoplasty,
okay,
and mid-face suspension.
What about her neck? She had a good neck to begin with.
She has a good neck. She's young enough to where she doesn't need a facelift.
And that's a big difference.
Big, big difference. And this is an operation that doesn't need to be repeated. Let me show you another example of what I'm talking about. This is a young lady that comes into me, doesn't feel very good about herself. Okay, now take a look at this before picture, Randy. This young lady comes into me. She's about 42 years old. She just had a baby. She's lost a lot of weight after her baby. She doesn't feel good about herself. Her friends tell her, look, she looks tired, she looks angry, she doesn't look happy. And
got kind of a tough face there.
Tough face. And the reason why is she's lost a lot of fat in her face, her brows have fallen down, her nose is too prominent. So what I did with her is I lifted her brows, I did her eyes, I put some fat back in her face.
When you said did her eyes, what did you do?
Well, I did an upper lid blepharoplasty.
When you say blepharoplasty, what are we talking about?
Well, I mean, take a look at her eyes, Randy. Look at her brows. Her brows are really low. Her eyes are a little bit sallow, and she looks sad.
So the heavy skin over her eyes is...
Well, that's extra fat, extra skin, and extra muscle.
Okay.
So what we do is we elevate the brow first and reposition the brow, and then we take out any redundant skin that's above the eyelids, and we take out the fat from below the eyelids. And the elevation of the cheek and repositioning of the fat into the face and a rhinoplasty altogether make the big difference in this patient. I mean, Randy, take a look at this after.
Yeah.
I mean, a dramatic difference.
I hate to say, I mean, she's pretty now. Where before she was just plain.
Yeah. I mean, we call her Holly Berry in the office.
Is that right?
Every time she comes in, because she's very attractive now.
What does she say, by the way? Because this is a great result.
Oh, well, I mean, she's walking on a cloud when she walks in.
How does somebody like this life change?
Well, I think it makes them feel so much better about themselves. I mean, you know, it's rough sometimes when women have babies and they go through that type of a change in their life. I mean, their life changes and they still want to feel pretty. They still want to, feel good about themselves. And I mean, I think the adjustment would occur without this, but this really makes it much better for the patient.
Now, she looks very natural. If I saw her, it doesn't look like she's had anything done. And probably 5 to 10 years younger.
Really? Yeah, I think so too. Now here, Randy, here's another example of the same type of patient. This lady comes into me, she's 46 years old. I mean, look at the before. She's got a prominent nose, she's got kind of a drooping brow, and she looks a little sad. She looks sallow in this photograph. And I mean,
she's a pretty girl. I mean, what bothered her in particular?
She has pretty features. I mean, she didn't like her nose, it was too prominent. She just felt like she was getting old. Okay. That's what bothered her. And so when people come in, we put them on the computer and we show them what we can do to make them look younger. And I mean, look at the after in this photograph.
Yeah,
you see the difference. I mean, this woman looks like a young, attractive woman again.
Yes, very sophisticated look as well.
And I get so excited when I see a person like this because I can see what I can do. It's like a canvas that comes in, I can change. And I mean, these types of patients truly excite me.